So I think another key opportunity we have to improve the outcome of patients having operations, having surgeries, is the role of carb load, the carb loading before the operation. And so we have robust evidence that if you give about 50 grams of maltodextrin, a complex carbohydrate, 2 hours before the operation as a clear liquid, you can reduce complications and length of stay significantly. In fact, you can reduce the length of stay of a patient having a major abdominal operation by 1.5 days. Again, these are little drinks or little drinks that cost a few dollars that could save days in the hospital and thousands of dollars in costs to the hospital and to the patient. And so just on that alone, this is an enormous effect. But it has to be done correctly. So all the studies that have been done to this point have used a certain amount of a complex carbohydrate called maltodextrin existing in the right concentration and the right osmolarity to be safe for someone to take 2 hours before surgery. Our anesthesia guidelines, I'm an anesthesiologist by training, say that you can take clear liquids up to 2 hours before surgery safely. And so we often hear people concerned about the carb load saying, oh, we don't want our patients drinking something 2 hours before surgery. But our guidelines that have existed since before I was a resident, so more than 20 years now, say it is entirely safe and reasonable to take a clear liquid up to 2 hours before an operation without worrying about aspiration when you send people off to sleep and induce them and have to put a breathing tube in. And so I think that's the first hurdle that we've had is I think anesthesiologists and surgeons have said, oh, I don't know about giving patients things to drink like that 2 hours before surgery, but our guidelines have always said that was safe. So that is not an issue, and that should never be thought of as an issue. But I think what is critical is this has to be done correctly. And unfortunately, what's happened with this new literature showing these exciting benefits that go beyond actually just the length of stay, people who take these carb loads also have less nausea and vomiting after surgery, less thirst, less pain. They feel better, they eat sooner, they go home sooner. There's lots of benefits to this. But what's happened, unfortunately, is people have said, well, why don't we just give them any kind of carbohydrate, sugar-containing drink before surgery? Why don't we give them Gatorade or a sports drink or orange juice, and wouldn't that be the same? Well, it's not the same. A, they haven't been studied, and so we don't know if they benefit the patient because the key of the maltodextrin is it was formulated that way because it induces reductions in insulin resistance when given that precise way. And we don't have any evidence that the other carbohydrate loading solutions have that same benefit or have any benefit. The other problems with the simple sugars of Gatorade and orange juice and other sports drinks is they don't empty the stomach the same way, and they could increase the risk of aspiration, right? All the research has been done with a complex carbohydrate maltodextrin, and all the research that shows it's safe to do, the patients don't aspirate, and they have better outcomes, have been done with only that specific carbohydrate mixture. If your patient or a patient was to aspirate and have a complication because they had Gatorade or orange juice, you couldn't really defend yourself because there's no evidence to say it's safe. We know that simple sugars and the osmolarity of those drinks is not the same and don't empty the stomach perhaps as successfully or as efficiently. And why would you use something that there's no evidence for and could create risk? I think the other key feature that needs to go into doing these correctly is these drinks need to be taken over about 5 to 10 minutes. They need to be taken in quickly, and so we have to instruct our patients to do that. They can't be sipped over hours. And then I think the other thing that has kind of begun to permeate into some of the commercially available carb load drinks is people have thought it was a good idea to add amino acids like arginine or citrulline or some of the other amino acids that may benefit surgical patients in other settings. The problem is we know amino acids, especially things like arginine and citrulline that generate nitric oxide, can delay gastric emptying. And so they can slow the stomach emptying. They could potentially lead to an increased risk of aspiration and complications for the patient. So again, none of us that have studied this literature for a long time or does research in this area would suggest using drinks that also contain amino acids as attractive an idea that may have been. And so I think what's important and unique about Carb Ready is it uses the carbohydrate content and concentration that exactly mimics the one that has been studied for years to be beneficial and safe. And I think that's what's critical. anyone who's trained for a marathon knows that you don't go into a marathon or a major stress, which a marathon is, without carbohydrate loading the night before and the morning of. And that's how we suggest our patients do it. They should take 2 amounts of the carb load, or 100 grams of the sugar, the complex carbohydrate, the night before surgery, before midnight, and then 1 carb load carb-ready drink the morning of surgery, just like someone running a race or a marathon would do. Again, the body doesn't do well, it doesn't tolerate stress well when it's fasted immediately before the stress. And that's what our fasting guidelines often make our patients do, but now we've overcome that through the safe use of these liquid carbohydrate loading drinks. But it's critical that the right concentration and right content, which is what Carb Ready delivers, is what's used, because that's the only thing we have evidence for safety and benefit from. And I think that's essential, and that's why this product is so important. It provides patients with exactly what has been studied and what they need in a simple to use formulation.